Good evening, Ian Henderson with ABC News.
In November 2016, a severe thunderstorm bore down on Melbourne, Australia, just as the springtime humidity was peaking.
Gusty winds coincided with an extreme pollen count to cause what's known as thunderstorm asthma.
More than 8,000 people in the region sought emergency services for asthma attacks that night.
There are a lot of people who called last night who have never had asthma before, so this was their first ever experience.
An elephant had his foot on my chest for about 4 hours.
Eventually, 9 people died. It was a chilling reminder of asthma's diversity and power.
9 people, some of whom hadn't been diagnosed with asthma, actually died. Now, although thunderstorm asthma is probably a separate condition, it does reflect the fact that asthma can still lead to mortality. So in terms of asthma prevalence in each age group, the biggest concern is in children and older adults. There's a worsening risk of asthma death in the elder population.
We're seeing an increase in asthma. We think that that's linked to more sort of westernisation, particularly on a global level.
An estimated 300 million people suffer from asthma worldwide, making it one of the most common chronic respiratory diseases.
In mild and moderate asthma, one of the challenges facing us is the potential increase in prevalence worldwide from developing countries. And there is some thought that as developing countries adopt a Western lifestyle, there'll be an increase in prevalence in asthma in those countries.
Dr. Dominic Shaw leads the University of Nottingham's Research Consortium on chronic severe asthma.
The potential increase in severe asthma depends upon how you define it. What's been interesting over the last few years worldwide is that we're now better identifying patients at risk. So if you take patients at risk being those who use more than 12 canisters of short-acting beta agonist a year, or more than 2 courses of oral corticosteroids a year, or persistent symptoms or exacerbations, then we probably have seen an increase in the prevalence of difficult asthma. The GINA guidelines split asthma into mild, moderate and severe depending upon the steps, and there are 5 steps, step 1 to 5. When you take that into consideration with control, it gives you an overall picture of how severe or brittle. What I use, and I teach my colleagues to use, my junior colleagues, are the terms severe, difficult and refractory. Severe refers to uncontrolled asthma. Difficult asthma refers to patients whose asthma is uncontrolled, perhaps due to other issues, such as obesity, dysfunctional breathing, poor treatment adherence, other issues. Where refractory asthma refers to patients who take the treatment, we've minimised all the other problems with asthma control, and they still don't respond to high-dose inhaled corticosteroids or oral steroids. Asthma is a complex heterogeneous condition. That means it reflects lots of different underlying pathophysiological processes. These include mostly airway inflammation, airway hyperresponsiveness, that's how you respond, how your airway muscle responds to an agonist. And these 2 processes lead to variable airflow obstruction. The key thing is symptoms. Patients don't complain of airway inflammation and hyperresponsiveness, they complain of cough, wheeze and breathlessness.
The risk factors for asthma are as variable as the disease itself. An overwhelming number of sufferers have allergies, as many as 70%. Genetics and the environment play a role as well.
Twin studies, for example, show that around 50 to 60% of asthma is inherited. And then other things would be sort of environmental things. So we know that maternal tobacco smoking has an impact on the fetus and the risk of developing asthma later in life.
In terms of reducing the number of patients with asthma or people with asthma, it's actually quite a difficult balance. And I say that because of the tests. The diagnostic tests available for asthma are not gold standard, and they are all open to variation and interpretation.
And I think as we sort of understand asthma more, I think it'll help us to be able to diagnose it better and treat it better. And I also think the other big challenge is at the more severe end of the spectrum, that actually there are a lot of people who are living with asthma and it's very disabling.
Healthcare providers and clinicians and academics wrestle with the fact that we still have a condition that kills people and that is eminently treatable with very simple medication. At the same time, there's an increased cost and a downside to overdiagnosis and treatment. getting that balance right is quite difficult.
Join us next time for a look at the burden of asthma, how it impacts patients' lives and what it costs the healthcare system.